Yeah, absolutely. That's a great question. So hallucinations are kind of one of the core, just realities of working with what is considered to be a non-deterministic system. So I'm going to do my best not to use technical terms here, but if anybody is a fan of photography, there's such a thing as a kind of a lossless image, right? That preserves everything about that initial kind of raw image capture, and then there's a lossy image where you kind of perform compression on it to make that file smaller. Large language models, which is the underlying technology that powers most of kind of the AI revolution, they're lossy kind of compressions of all of the data that goes into them. And as a result, it's this big statistic model that's kind of looking at all of the data that it's being given and being asked to kind of predict what should come next. And that's a oversimplified explanation of what these systems do. But the reality is kind of every time it's creating something, it's making a prediction and it's making a guess, right? And it's doing inference, right? It's inferring the next answer. And so as a result of something that is by definition non-deterministic, you know, it can just give highly confident incorrect answers. And there are ways to mitigate that, and there are ways to not mitigate that. And these tools are they're very steerable, but essentially those hallucinations happen by not guiding the system with either clear enough instructions or grounding them in enough context. And so where I'm going to plug IMO here, because we love working with them, is that one of the ways that CarePilot reduces hallucinations is we actually ground them in context at the point of care, right? We don't rely on the model's kind of inherent knowledge to inference out the right answer. And the way that you reduce those hallucinations is you give it information, something like an IMO lexical with its underlying information and maybe a definition or something to help ground it in context to steer the model in the right direction.